So we decided to take a chance and do a pilot. And so we did. And then based on the results of that pilot, we said we wanted to move forward. And so, that was really a game changer for us. And, we did. We took a huge leap of faith. And last year, we moved away from a delegated vendor that we had been using for almost 20 years. And that was huge, to terminate a contract that was, very comfortable, that we had been in a relationship with for a very long time and had a great relationship with, that our entire state knew exactly who they were, where they needed to go. And here we were gonna, rip out the rug underneath all of these providers that knew exactly what to do because we had trained them and educated them, and we were about to change it all up. And so it was a lot of work. It really was. And so for us, it was a commitment. But really, ultimately, for us, it was about reducing our administrative cost, not only for us, but for our providers. We knew we could gain efficiencies, not only internally, but also for those physicians. There's so much abrasion and so much overhead for our providers for authorizations, and they get no return. There's no revenue generated when they have to spend money to add staff for these types of transactions. So we knew that we could eliminate a lot of manual processes, we could reduce their expense, and then ultimately we could improve that experience for both our members and the providers. Yeah. And it was going to be a win-win if we could pull it off, and we did. This technology has allowed us to ensure that the yeses are getting done appropriately, and that the work that cannot be done through the AI is going to our appropriate clinicians to be reviewed. Mm-hmm. So, it's one of those things, we're removing the easier work, and we're keeping the work that does need to be reviewed by a clinician on their desks. And so, when you're talking about 800,000 transactions that we moved away from a delegated vendor in a year, and we're bringing those all back inside, that is a lot of members, and that is a lot of requests. So for us, we would have had to we would have had filled that building full of nurses had we not had this technology in place.